Good morning, everyone. My name is Kathy Waitman-Moore, and I serve as the Director of the Diocese of Rockford Catholic Charities. Beginning in 1946 as the social service arm of the diocese, Catholic Charities is committed to compassionate and respectful service, assisting people to live with dignity, achieving their highest potential, and working with others of goodwill and advocating for justice. Through a wide array of services to individuals and families within our 11 counties, Catholic Charities works to improve lives and strengthen families. Outreach to our communities is important as we work to ensure our services are available to all those who need us. At this time, I invite each of our program directors to take a moment and provide a brief description of these services. Here's Richard with our counseling program.
Hi, my name is Richard Parsons, and I direct the counseling program at Catholic Charities. Our program responds to the needs of individuals, couples, and families, and helps them manage and resolve a wide range of challenges. Our committed staff provide quality, affordable care that is individualized and confidential. Able to see people in our community offices in various locations in the diocese, we're also equipped to offer counseling through telehealth for the convenience of those who might face barriers traveling to see us. In addition, our professional staff provide school counseling at Catholic grade schools in several areas of the diocese and respond when needed to schools experiencing a crisis or loss. Catholic Charities post-adoption search program continues to assist persons in the adoption triad, birth parents, adoptees, and adoptive parents who decide they want to search for their relatives and reconnect. We have recently begun to develop support parish mental health ministries that respond to the needs of individuals who face mental health and substance abuse challenges, supporting the families that care for them, encouraging engagement in services necessary for recovery, and assuring that all find a loving welcome and prayerful accompaniment in their faith community. It's my pleasure now to introduce Amber.
Hi, I'm Amber Emmert, and I am Program Director for 3 different programs in Catholic Charities: Bilingual Outreach, Emergency Assistance, and Project Hire. Advocacy and support are 2 crucial elements of Catholic Charities' Bilingual Outreach program. Our bilingual, bicultural staff work with individuals and families in order to gain self-sufficiency. Staff advocates for medical care, education for children and adults, stable housing, employment, and services for older adults. Staff assists in translation with benefit applications and other assistance forms. As needs are identified, individuals are connected to community resources. Resources are vital to assisting individuals and families facing hardships, such as loss or reduction of employment, accidents, disability, death of a loved one, homelessness, or mental or physical health challenges can cause individuals to lose hope. The Emergency Assistance Program offers help for those who are experiencing economic hardship. Staff offers encouragement, resources, referrals, and some financial assistance to help families become self-sufficient. Another path to self-sufficiency is through hire, or helping individuals regain employment, where Catholic Charities staff prepare individuals to successfully enter into the workplace. Participants learn skills needed to access employment resources, understand employer expectations, in addition to job searching, interviewing, resume writing, and job readiness. Lori is next.
I'm Lori Larson, and I'm the Program Director for our Pregnancy and Parenting programs. Our outreach services provide support and case management to any individual or couple who is facing the uncertainty and the challenges of an unplanned pregnancy. Our adolescent outreach program is tailored specifically to the needs of teens who are already trying to find their way through adolescence, but have the added responsibility of being a young parent. Additionally, a few years ago, Catholic Charities began taking a serious look at what we could or should be doing in the fight against human trafficking and domestic violence. I oversee those efforts, and I work alongside others in our communities to raise awareness and increase education about the harsh realities of exploitation and interpersonal violence. And now, Janet.
Hi, my name is Janet Biljashkovic. I'm a Program Director of Refugee Resettlement Services, operated under auspices of the United States Conference of Catholic Bishops. Catholic Charities Refugee Resettlement Program works with U.S. Department of State, Homeland Security, and Justice, providing services to newly arrived refugees from many war-torn countries. Catholic Charities staff, many who came as refugees, assist individuals and families to transition from a life that is often filled with fear, violence, and terror to a new life filled with hope. I introduce you now to Yosdel.
Hello, my name is Yosdel Trujillo. I am the Program Director of the Immigration Services. The immigration program provides immigration legal assistance to indigent and low-income immigrants and some U.S. citizens who need immigration counseling, including applications for citizenships. Doing so, we help to reunite families and empower individuals, placing them on a path of self-sufficiency and success. And now I will leave you with Terry.
Hello, I'm Terry Hill, and I am the Program Director of St. Elizabeth Catholic Community Center. We have been in the Rockford area since 1911, serving the needs of people in our community with limited resources. The services we offer in our adult building include a food pantry, a soup kitchen, clothing closet, and employment readiness. In our youth building, we offer before and after school care, summer camp, and a preschool, and all of these services are subsidized. And now I'll hand it off to Julie.
Hello, my name is Julie Shupner, and I'm the Program Director for the Long-Term Care Ombudsman Program. And you're going to be hearing more from the Ombudsman team in just a moment. Thank you.
Thank you, everyone. We at Catholic Charities are grateful for the opportunity to work together to meet the needs of individuals and families in our communities. And now you'll hear more about the Ombudsman program from Julie and her team.
Hello, I'm Julie Shupner, the Regional Ombudsman and Program Director for the Long-Term Care Ombudsman Program. Catholic Charities is the Ombudsman Program service provider for the 9 northwestern counties of Illinois, including DeKalb. In total, we have 123 long-term care facilities that we visit with over 6,000 residents. In DeKalb, there are 7 skilled nursing facilities, 2 assisted living, and 2 supportive living facilities. In total, there are approximately 1,000 licensed beds in DeKalb within those facilities. So what is an ombudsman? An ombudsman is a Swedish word meaning citizen's representative. A long-term care ombudsman is an advocate who seeks to resolve complaints on behalf of adults who receive long-term care services. Ombudsmen are the designated advocates for adults in long-term care, whether they are there for short-term or long-term periods. The Ombudsman program was mandated in the early 1970s by the Federal Older Americans Act to protect the rights of nursing home residents by investigating and working to resolve their complaints. In addition, the Illinois Act on Aging gives ombudsman authority to advocate on behalf of long-term care facility residents. In order to get to know our program better and who our staff are that do this important work, we will each take a moment to introduce ourselves and discuss some program information. And so with that, I will turn it over to April Smotherman.
Hello, I'm April Smotherman, Community Ombudsman for DeKalb and Boone counties. Ombudsmen regularly visit long-term care facilities to talk with residents about their care and their quality of life. Ombudsmen educate and empower residents to advocate for themselves. Ombudsman must have permission from the resident to advocate on their behalf, along with the consent from the resident to share information with any other entity. In addition, ombudsmen are not mandated reporters. Ombudsmen also provide education to community-based organizations and facilities. Ombudsmen meet with individuals one-on-one and as a group if required. Ombudsmen engage in person directed advocacy and do not take action without the permission of the resident. Problem solving and complaint resolution are the primary means that ombudsmen use to assure that residents are understood and honored. If a resident lacks capacity, we take direction from the legal representative, such as the guardian, POA, or healthcare surrogate, unless the legal representative is either not acting in the resident's best interest or is not following the resident's known wishes. In those cases, ombudsmen take direction from the state office. I'll now turn it over to Ombudsman Jasmine Clay.
Thank you, April. Hello, I'm Jasmine Clay. I'm the Community Ombudsman for Ogle and Winnebago counties. The mission of the Long-Term Care Ombudsman Program is to ensure that older persons and adults with disabilities receive quality services and are able to live a dignified life at the highest level possible by providing advocacy services for residents of long-term care facilities. Ombudsmen promote and advocate for residents' rights. Residents of long-term care facilities have numerous rights under federal and state law. These rights include, but are not limited to, right to be informed about and exercise their rights, right to freedom from chemical and physical restraints, right to know about services and financial charges, right to participate in planning their care and their treatment, right to refuse treatment, right to confidentiality of records, right to privacy, right to control their finances, right to freedom from abuse, neglect, and exploitation, right to express grievances without fear of retaliation, rights pertaining to admission, transfers, and discharges, including the right to appeal, right to communicate freely with persons of their choice, right to purchase and install audio and/or video devices with consent of his or her roommate and after notifying the facility for skilled nursing facility residents. And now I would like to pass it over to Christine Adams.
Thank you, Jasmine. Hello, I'm Christine Adams, the Volunteer Coordinator and Community Ombudsman for facilities in Winnebago County. We have volunteers in the program and volunteer opportunities as well. There are several components to the work of the Ombudsman. Ombudsmen identify, investigate, and resolve complaints. Ombudsmen provide a regular presence in long-term care homes. It is important for us to make connections with the residents so they know who we are and that we are there to offer assistance if needed with concerns. We provide consultations and educate residents, family, and staff on a wide range of topics. Ombudsmen conduct community education sessions on topics such as resident rights, care plans, and most recently, bullying inside long-term care. Ombudsmen work on advocacy through legislation and other means with the goal of improving the quality of life for those in long-term care. Ombudsmen support the development of resident and family councils. Resident councils are meetings run by the long-term care residents to discuss concerns inside the long-term care facilities. The family councils are run by the family members of long-term care residents and can be held in the facilities at other locations of their choice or by virtual meetings. And with that, I will pass it over to Joan.
Hello, I'm Joan Stahulak, Community Ombudsman for most of Winnebago County and one nursing home in Ogle County. I've been with the program since 2007. Federal and state law both require strict confidentiality. An ombudsman may not share any information with anyone outside of the Ombudsman office, including legislators, surveyors with the Illinois Department of Public Health, lawyers, for example, without permission from the relator. This rule applies to all communications, whether from hospitals, social service agencies, families, friends, residents, nursing home staff, police, All communications to the Ombudsman are confidential unless released. Confidentiality is key to the success of the work done by Ombudsman as it forms the basis for a trusting relationship. Jake?
Thanks, Joan. Hi, my name is Jake Smith, and I'm the Ombudsman for Lee and Whiteside counties. There's often confusion between the Long-Term Care Ombudsman Program and IDPH surveyors. The main distinction is that IDPH is the regulatory agency that assures that long-term care homes are meeting minimum requirements set by law and can issue citations if violations are found. The Long-Term Care Ombudsman Program is the agency focused on advocacy to improve the quality of life for residents of long-term care communities. The Long-Term Care Ombudsman Program does not regulate the homes, but instead works to address and resolve resident concerns that may or may not be regulation related. There's several different distinctions between IDPH and the Ombudsman Program. First being that the IDPH are regulators and that their focus is on regulating the nursing homes and following the standards set by law. IDPH creates guidance for long-term care facilities and enforces those policies through those citations. They enter nursing homes for annual surveys and also when complaints are filed. They base their citations on minimum requirements, and their survey results are open to the general public. As far as the Ombudsman Program, we are advocates for the quality of care and quality of life for nursing home residents. We maintain a regular presence in the facilities with at least quarterly visits. Our casework is often based on requests for assistance by or on behalf of a resident. Our casework is geared towards surpassing those minimums. The Long-Term Care Ombudsman Program provides community outreach to other agencies, families, and friends of those in long-term care. And the Long-Term Care Ombudsman Program's work is all private and confidential. And with that, I'll pass it over to Brody.
Thank you, Jake. Hi, I'm Brody Hooker, and I'm the Community Ombudsman for Carroll, Joe Davies, Stevenson, and part of Winnebago counties. There are a number of different types of homes that we have jurisdiction in. The types of facilities in our authority include nursing homes, that's skilled and intermediate, state veterans homes, assisted living, supportive living facilities, sheltered care facilities, intermediate care facilities for the developmentally disabled, we call those ICFDDs, specialized mental health rehabilitation facilities, or SMRFs, and medically complex for the developmentally disabled, or MCDD. Now, not all these facility types are located in the 9-county area we service. Nursing homes, assisted livings, and ICFDDs make up the bulk of the homes we visit, along with 2 MCDDs. We serve older persons and adults with disabilities who reside in long-term care for short or for long-term periods. Ombudsmen do not have jurisdiction in independent living facilities, SILA homes, that's community integrated living arrangements, or in state-operated facilities. If you're a resident in long-term care or know of someone in long-term care that needs assistance, we're there for you. Up next, I'm going to hand it to Lori Limbaris.
Thank you, Brody. Hello, my name is Lori Limbaris. I'm the Administrative Assistant and also a Certified Ombudsman. Designated Illinois Long-Term Care Ombudsmen have the right to enter long-term care facilities at any time without restriction. The only person who can deny access to the Ombudsman is the resident themselves, should they decide not to speak with our program. In addition, the Ombudsman have 24/7 access to facilities. A facility cannot interfere with a resident's right to visit with their Ombudsman. Ombudsman may access medical records only with residents' permission. Anyone can file a complaint with an Ombudsman. The complainant's name and identifying information is kept confidential. Ombudsmen are usually contacted by long-term care residents, family members of residents, facility or program staff, other social service and advocacy groups, hospital personnel, legislators, public at large, and law enforcement. Okay, I'm going to hand it back to Julie to conclude.
Thank you. And thank you for taking time to learn more about the Long-Term Care Ombudsman Program and how we work within long-term care in the local community. To contact our office, you can dial 1-800-369-0895 or 779-210-8700. Or you can find us online at catholiccharities.rockforddiocese.org. The Long-Term Care Ombudsman are proud to be a partner with United Way. Thank you.